understanding shoulder impingement, the most common issue faced by weightlifters, is our topic for tonight. And I'm so excited to talk about it because I myself just got over shoulder impingement from a long 4 to 6 week journey from playing so much tennis. Right, I had a little bit of tendonitis as well as playing too much golf on the right arm, which is my dominant side. So we're going to take you through the process I use to help me get out of pain as well as other clients. And really, guys, last month we spoke about the thoracic spine. We talked about starting in the middle, working your way out towards the kind of outline of the body there, or the kind of proximal to distal kind of progression, so to speak. We talked about how the thoracic spine relates to the shoulder, so make sure you start there with your foundation. And guys, if you're a weightlifter, you need to pay attention to this. So get out a pen, get out paper, get out your phone and your notes application if you need to. We put a lot of strain on our shoulders. That doesn't mean we have to live with kind of pain and limited mobility because of that. It doesn't mean we have to struggle to reach behind our back to put our belts on in the morning. It doesn't mean that we have to struggle to kind of reach up to the top cabinet to grab a coffee mug out first thing in the morning as well. Okay, so we're going to talk about how to tackle shoulder impingement because I get asked a million questions about this. Everyone tends to get it at some point in their life, mainly from posture reasons, mainly from doing the same activities over and over again, and mainly from not varying up kind of their exercises that they do in their daily routine. Right, so we're going to talk about three things in detail. Number one is what is shoulder impingement. We're going to break that down for you, give the definition of it from our anatomy and physiology book. Number two is we're going to talk about how many types of shoulder impingement are there. There's two specific types. We're going to break those down for you and show you some images to kind of show you more detail there. And number three is what is the difference between shoulder impingement and tendonitis. Okay, so we're going to talk about how they relate to one another and how they're different from one another as well, so you can differentiate the two so you don't get stuck doing the wrong type of treatment for one versus the other. All right, so with that being said, let's dive into the topics for tonight. We're going to start with what is shoulder impingement. And guys, shoulder impingement is something very, very simple, right? It's usually an umbrella term. Umbrella meaning it encompasses a lot of different things going on in the shoulder that therapists or doctors diagnose you with when they don't truly know exactly what's going on, or they suspect it based on a variety of tests that you can do to kind of pinpoint the issue, which we're going to talk about in our next call, right, which are special tests. So the definition is compression of the structures underneath the acromion bone during elevation of the shoulder. Right, so what is the acromion bone? It kind of sits here. It's the edge of your shoulder joint here. So it just means compression of the structures. So you have your bicep tendon, you have a supraspinatus tendon of your rotator cuff there, and you have a subacromial bursa. Subacromial just means that kind of the bursa sits underneath the acromion, right? That bone we just mentioned, and that bursa helps kind of guide the motion throughout the joint. So sometimes you can have bursitis, and that can be confused with tendonitis or rotator cuff impingement as well. Okay, so the mechanism of injury usually is from like encroachment or kind of compression of those bony or soft tissue structures or structural deformities, which we're going to talk about. It could be from poor control and coordination as well, or it could be from adhesive capsulitis, which is another term for frozen shoulder. If you guys have frozen shoulder, we're going to be doing a little bit more kind of topics and information on that in the future, so stay tuned for that. So that is truly what shoulder impingement is. And again, it could be the compression of those structures that we just mentioned, causing the kind of issues and the damage there. All right, so next topic is, what is or what types of shoulder impingement exist out there, right? There's really a primary type and there's a secondary type. So with primary, it's usually from congenital or age-related, usually in the elderly is where we see it, right? It usually means that kind of, you're having these kind of issues with impingement because of the shape of your actual shoulder joint and the acromion bone. So there could be acromial structural deformities, meaning it could be like overly hooked. It could be osteophyte formation, meaning like calcium buildup and excessive bone growth there, or it could be from rounded shoulder posturing over time. And that's why we see it more in the elderly over time. Right. So there's three different types. And you can see in different images, like where it's kind of hooked one way, it's hooked the other way, and then the other way is really hooked. And a lot of times that bone can push into your actual bicep tendon or your rotator cuff tendon. And if that's the case, guys, usually physical therapy isn't going to work very well for you, depending on your age and severity of your symptoms. But a lot of times you can mobilize kind of the joint to help open up the kind of area a little bit more between the acromion and the actual tendons to give it more space to breathe and function. A lot of times you can kind of increase your flexibility of the muscles around it, and you can improve your strength, which is also helps set your joints up in a better space because, what connects joints to joints? You do have muscles, then you have your ligaments. So that really helps. But if it's a structural deformity, there's only so much you can do. And sometimes you have to opt for surgery where they actually kind of wear down some of the bones with their kind of medical tools and things like that, where it's called debridement, where they actually clean up the joint a little bit and shave down some of the ligaments and some of the calcium buildup there. All right, that's a topic for another day. We won't dive too much into that. So that is primary typically. The secondary version is instability of your shoulder joint, secondary to hypermobility. So you have excessive mobility, like a gymnast, so to speak, or you have rotator cuff weakness. Okay, so it's usually seen more in the kind of younger populations, like swimmers is a common one, volleyball players, baseball, like softball players, track throwers, right? Those are the common ones that we see this secondary type of impingement in because they do a lot of overhead mobility type work, and they're dynamic stabilizers of the rotator cuff, as well as their static stabilizers of their actual kind of ligaments at the shoulder joint and the capsule are just not doing their job sufficiently. And that's why they're getting some pain in this kind of process. All right, so hopefully that makes sense. That's the difference between primary and secondary, and those are the type of different things that we see. And obviously the treatments are going to be very different for primary versus secondary. Okay, so our third and last topic is going to be, what is the difference between shoulder impingement and tendonitis? All right, if I had to break it down for you, we went over the definition of impingement, right? It's really encroachment or compression of those structures underneath your acromion bone during elevation of your shoulder. An elevation of your shoulder is a combination of multiple movements, right? It's a combination of shoulder flexion, external rotation, and abduction. So it's all three of those motions working together to get your arm up over your head, or there's a combination of three other motions, right, to reach behind your back. Okay, we won't go into that in too much detail, but impingement really starts depending on your mechanism of injury, right? Tendonitis can start depending on your mechanism of injury as well. It really depends on like how they kind of come about. But I will say most commonly people get impingement first when they get that weird discomfort in their arm when they're reaching for things or going over their head or with shoulder pressing. And then impingement gets so bad over time as we don't do anything about it to fix it that it becomes tendonitis. So it can become bicep tendonitis if you're long head, or it can become rotator cuff tendonitis if you're supraspinatus tendon. And I'm going to share my screen in a second and show you guys how close those two are in proximity to each other and why they do get affected and how close they are to that acromion bone where impingement typically happens. But if you have impingement happening and you have kind of brushing of the bone against the tendons over time, it's going to cause inflammation. That inflammation is going to make it become a tendonitis. And if you don't do anything about it, it's going to become a tendinosis where it degenerates over time. Then you'd eventually develop a partial rotator cuff tear, then it becomes a full complete tear. And with a full complete tear, guys, you need surgery without a doubt. If you want to be able to function, use your arm again and lift things, you usually need surgery. There's usually a small percentage of people from like 5 to 20% who can avoid surgery, even if it's a complete tear. But usually if you're young, you like to use your arm, you want to throw a ball, you want to lift things, you want to go to the gym, do pressing, do push-ups, right? Then you need to have that repaired. Okay, so tendonitis typically might differ a little bit because it happens from overuse, right? It's when you kind of stop doing something and then you dive back into doing it too quickly. And it could be a sport when you have a long off season, you take too much time off, or and you typically what happens is you exceed the load capacity level or tolerance of that tendon by doing too much too soon. All right, and that can happen from a lack of rest or recovery or a lack of variation in your exercise or daily movements and postures. Okay, and rotator cuff and bicep tendonitis are the most common, like I just mentioned. So hopefully this all makes sense. If it doesn't make sense, guys, ask me some questions down below in the comment section. I tend to talk too quick, so I apologize if I have. If I have talked too quick, let me know in the comments, or just kind of go back and rewatch this because it's super, super important and awesome information here for you guys. Right, we spent a lot of time prepping this for you, and we're going to make an awesome kind of PDF guide for you at the end with some exercises you can do for mobility and strength. So make sure you kind of watch this month's series. But the last thing I want to do with you before we wrap up here is I want to show you and share my screen kind of where these kind of anatomical kind of areas are that we're referring to. So any visual learner here will get a lot out of me sharing my screen so you can better understand kind of exactly what's going on and how to deal with it. Because a lot of times people never get shown this stuff and they never get explained it in physical therapy, and that's why they don't believe in it. They don't think it's actually kind of truly an issue. All right, so if we're looking at here, we're going to see your shoulder joint. I kind of already removed the layer. You can add a layer here, right? Your deltoid sits on top. If we take the deltoid off, you can see your biceps are right here. You have your short head of your biceps kind of going up here, the inner part of the arm. Then you have your long head of the biceps. So most commonly, the long head's affected because this here is your acromion bone. You can see it kind of hanging off the edge of your shoulder. So this space should be nice and kind of big between your acromion and your shoulder joint. But a lot of times if it's not, you can see how that acromion pushes into these structures. So that little red area there is your supraspinatus muscle. right? That's one of your most commonly damaged rotator cuff muscles that leads to impingement on the top here. I'll show you from a side view in a second. And then your long head of your bicep tendon is right next to it, sits right in front of the supraspinatus muscle. And this is a supraspinatus tendon. So those two can easily get compressed when someone reaches their arm over their head because this spot closes in on this space, right? So you can see it from the side, the acromion here, right? We look from behind. This is the supraspinatus muscle right up here, right? It's that little red thing there that kind of comes down, right? So if we clicked on the bicep tendon, this is where it would kind of take me, or excuse me, the supraspinatus muscle, not the bicep tendon. This is what it looks like, right? It sits on the top of the shoulder, right? This is the acromion bone here, and it kind of connects right here to the side of the humeral head, right? So in a lot of people, if I play this, you can see how it gets compressed, right? So if you have a nice healthy shoulder, this should happen. So you should have still decent, adequate space between your tendon and the acromion bone here. If you don't, what's going to happen is those two areas are going to compress against each other. Or if you have a primary impingement, like we talked about, and you're older, you have poor posture or hooked acromion, this acromion can be hooked so much that it can compress this area and it can actually press against it. It can lead to bony buildup and osteophytes, which are ridges in the bone. And that becomes a really painful and kind of horrible thing to deal with that you usually have to opt for surgery for. So that's why it's so important to kind of work on the strength of the muscles around your shoulder blade, guys, because if you can do that, it's going to help take some tension and let these areas kind of relax and recover a little bit more. Okay, it's also going to pull your shoulder blade into a better position on your rib cage if you can strengthen all those periscapular muscles around the shoulder blade, like your middle traps, lower traps, your serratus anterior, which we've talked about before. And you know, a lot of times you can throw little massages at your tendon for tendonitis, or rotator cuff tendonitis, or even impingement, but you have to truly find the cause of the issue. So you would have to get manually muscle tested or have someone online like me take you through some tests. And if we can figure out like what muscles are weak and what kind of is causing your pain, maybe it's the way you're doing a certain lift, right? It could be your form with it, when you shouldn't be doing it, or you should be kind of maybe doing it at a lighter load or lower repetitions. Then, you know, that is something you need to listen to and apply in order to get better. Okay. So that is everything in detail. Let me stop share here. Guys, if you have questions, again, I get so many questions on this topic. So please, if you have any, feel free to put them down below in the comments. If you're on Facebook or if you're watching on YouTube, same thing, go below in the comments. We did make a nice kind of PDF guide for you guys on thoracic mobility, on how to improve it, and then thoracic strengthening, how to keep that mobility. So if you guys kind of want access to that, look down below in the description on YouTube here, and you can see it. It's our thoracic guide on how to kind of revitalize the shoulder. All right. Hopefully this all makes sense again. And guys, thank you so much for watching. Well, we do this every week, every Wednesday. This is our first video in our series for this month of June for 2023, where we are talking about shoulder impingement, how many types there are, what's going on with it, what tests to do to see if you have it, and then how to fix it through mobility and how to keep it fixed through strengthening. All right. Thanks so much, guys. And we will see you in the next one. Have a great rest of your week. Bye.